My total hip replacement journey, August 29th, 2018, in Pleasanton, California. I am Dr. Judith Olund, having earned my doctorate degree in organizational leadership in year 2012. However, today I will share with you a much more personal journey. My decision for a total hip replacement. Over my past 70 years, I have enjoyed a wonderfully active life that began with dancing lessons as a young child and have continuously enjoyed all physical activities throughout the years. Even until most recently, often dancing at the local pub Friday and Saturday nights for 2 to 3 hours straight. So, yes, I ignored my slow but sure developing limp over at least 5 years and was finally diagnosed with osteoarthritis in my hips over 1 year ago, bone on bone. I never really considered surgery, feeling confident that perhaps losing a little weight would help with my developing limp. So I did work at it. I lost some weight and also began a wonderful collection of shoes, hoping that they would solve my walking problem, which was becoming more and more pronounced. More recently, it was becoming a challenge to walk from the dancing pub to the pizza joint, just 3 blocks down the road. My friends were wonderful, allowing me to lean on them, literally, as we went for our snack in the early morning hours. I had never really been a pill taker during my life, but I began to take a couple of NSAIDs just before going out to my social affairs in hopes of walking better and hiding my little limp. Not possible. But my friends were always so kind. Finally, I had a checkup with my general doctor, Dr. Calvin Lay, at Stanford Health Care in Pleasanton, California. We discussed my walking issue, which resulted in a referral to my now orthopedic surgeon, Dr. Salyapongse of Webster Orthopedics in Dublin, California. However, after my first consultation with the surgeon, I remained very hesitant. Maybe all I needed was a shoe lift. Funny how we rationalize when we just aren't certain about things. Well, when my general labs were assessed, funny thing, I wasn't even eligible for surgery because my blood sugar was a little high, and more importantly, my blood platelets were below the normal level important for surgery. So, I thought that just might be a stop sign for any surgery. Okay then, decision made. I thought it could be months before considering surgery again. Who knew? Dr. Lay soon referred me to an oncologist in order to check out my blood platelet situation. Dr. Kavita Raj, a wonderful oncologist with Valley Medical Oncology Consultants in Pleasanton, assessed my condition and informed me that while my low platelets were normal for me, my platelet count must be in a normal range for surgery. Okay. So I took some prescribed medication, wondering how long this could go on. Who knew? A few days after the follow-up blood test by Dr. Raj, I unexpectedly received a phone call from Dr. Salyapongse's office saying that I had been approved for total hip replacement surgery and was asked if I would like to schedule a date for surgery. I was definitely in shock, expecting to have months to reconsider surgery. I was then offered a surgery date in just 2 weeks, which had opened up due to a cancellation. If I had not secured this opening, I would have had a month wait for surgery. That is, if I had decided to go ahead. We penciled in the date. 2 weeks. So because I was instructed not to take NSAIDs for 10 days prior to surgery, I quickly realized how those little pills were actually masking my discomfort to a reasonable degree, more than I thought. By day 8, without pills, I was reaching for the walls in my home, not wanting to put weight on my left hip, and I was also compensating for my diminished hip movements by overusing my right knee, which was becoming notably overworked. It was my time. I had a choice. show up Wednesday morning for surgery, or go shopping for a cane and hide out more at home in the future? I showed up for surgery. Total left hip replacement by Dr. Salyapongse, anterior approach, scheduled for August 29, 2018. Having just celebrated my 70th birthday just 2 days before. I would like to share my surgery experience to add to your information gathering, but always remember we are each uniquely different. I showed up for total hip replacement surgery with Dr. Salyapongse at 6:30 a.m. on August 29, 2018 for admission to the Stanford Healthcare Valley Care Hospital in Pleasanton, California. Paperwork complete. It was now time. My time. I was escorted down the hall to the pre-op section and quickly asked to take 2 pills. I followed instructions and swallowed. Okay. I was then given my hospital gown, toothbrush, toothpaste, non-skid yellow socks to wear, and then asked to change and go potty. Also to brush teeth. Now it was time to get comfortable on the bed, so I did. 3 pre-op nurses were soon hovering over me, each doing their task, including the IV, asking many questions, and establishing monitors and so forth. I froze. What was I doing here? I questioned all my decisions in just one moment. I asked the 3 nurses if it was normal to get cold feet about this time. My sudden tears prompted a 3-nurse cheering team offering kind, supportive words of encouragement. My 1-minute freeze was over. Soon, the medical team and my family surrounded me. Dr. Salyapongse, my surgeon, now in his light blue scrubs, was asking me what procedure he was about to perform on me. I replied, a total left hip replacement, anterior approach, 4-inch incision, then moving the muscles with your fingers, giving access to the balls to be sawed off, which made way to the socket area, which would then be replaced with new materials. Then a test implant to hold the new ceramic ball would be fitted before implanting the permanent titanium implant. Well, somewhere along the line, the anesthesiologist mentioned that Dr. Salyapongse preferred that his patients have a spinal. I didn't have much time for debate, to my amazement, because the meds were doing their thing and a good cocktail was lingering in my IV. So then, after being wheeled into the operating room, I barely cared when asked to sit up and lean forward for the dreaded spinal, I leaned over with no cares. At some point, the anesthesiologist administered 2 shots. I couldn't really tell. Afterwards, I was asked to lay back, and I did. It seemed like the very next moment when I heard the words, "Wake up, you're done." Done. I was having such a nice sleep after months and months of restlessness. After surgery, no pain, no nausea, no dizziness. I took 1 pain pill as more of a precautionary measure by end of day 1. I was up and walking shortly after surgery, using a walker primarily to prevent any falls. Day 1 after surgery, no pain. I called it my brick leg, but no pain. I was up and walking, using a walker primarily to prevent any possible falls. Day 2 after surgery, I returned home, remade my new bed downstairs, and went upstairs for a shower. Nice. No pain. I am presently enjoying my recovery time and continuing to take meds for continued healing and good health. I feel amazing. Of course, as to be expected, I will continue with healing and adjusting to my new life, my new hip, and my new ability for excellent movement. My biggest lesson learned that I might share is to let others help you when you can. Trust in the positive side of things and accept blessings when they are right before you, and always, always give thanks. Dr. Salyapongse, I thank you for your excellent skills and for your dedication to help others, providing them an opportunity for a second chance of continued mobility and healthy living. Thank you to my dear family and friends for all your good thoughts and sweet prayers. Thank you to the medical staff and all related personnel who cared and helped so graciously. And thank you, God, who clearly urged me to trust others and let others help me, because He does care about everything we encounter. Recommendations: Dr. Calvin Castle, M.Lay, at Stanford Healthcare in Pleasanton, California. Dr. Aaron Salyapongse, orthopedic surgeon, Webster Orthopedics, in Dublin, California. Dr. Calvita P. Raj, oncologist at Valley Medical Oncology Consultants. Stanford Healthcare Valley Care Hospital in Pleasanton, California.